Have you ever wondered why you have a recurrent UTI? Today we are going to be discussing about that. Hi guys, my name is Melody and I'm a registered nurse. So like I said, today we are going to be talking about why some people have recurrent urinary tract infections. But first, what is a UTI? So a UTI is any infection that affects any part of the urinary system, and that could be the ureter, the bladder, the ureters, or the kidneys. So what symptoms could you be having that could signify you might have a UTI? First of all, there is urgency and frequency in urination. The next one is burning sensation or pain when urinating. Another sign and symptom is blood or hematuria. Blood is not a normal thing to be found in your urine. So if you see blood in your urine, that should also ring a bell. And then in some cases, you might also have fever or chill. Another thing is cloudy or smelly urine as well. Then there's lower abdominal pain. So some of these are the signs that should ring a bell that this might be a UTI. So next we are going to discuss about the risk factors and then the causes of a UTI. So most UTIs are usually caused by a bacteria, but what are some of those factors that predispose people to UTI? So the first one is anatomical structure. So because women have a shorter urethra, they are more prone to having UTIs. Another one is sexual activity. So people who are sexually active are more prone to having UTI versus people who are not. So another thing is any condition that prevents people from fully emptying their bladder can also cause UTI, because it means that the urine get to stay long in there and then bacteria begin to grow there. So if you have conditions like neurogenic bladder, stroke, urethral strictures, prostate enlargement, any condition really that prevents urinary bladder emptying can predispose people to UTI. So another factor is catheter use. So people who have catheters are most often um, more prone to UTIs. Another factor is women who are menopausal. So because of a reduced level of estrogen, they are more also prone to having UTIs. So what are some of the ways to prevent UTI? The first one I'm going to mention is to drink lots of fluid, especially water. So stay hydrated. Another one is to empty your bladder. Don't keep your bladder full for a very long time. Another one is to wipe from front to back, especially for women. Then avoid irritants such as caffeine, alcohol, and spicy foods. And then wear breathable fabrics like cotton. Urinate after intercourse as well. What is the management for a UTI? So if you suspect you have a urinary tract infection or you have any of the signs and symptoms I've mentioned, you can always speak to your healthcare provider. In the UK, you can meet a pharmacist. So the pharmacists, they are licensed to treat minor UTIs, and they could give you antibiotics or they will refer you to your GP if there is need for that. Also, you are encouraged to drink lots of fluid, as it helps to get rid of the bacteria from your urinary tract. Just before I end, it's always good to have any signs and symptoms that you feel concerned about. It's always best to have it checked by your healthcare provider, as UTIs can sometimes progress to very serious complications. So always have it checked out if you are concerned. Thank you guys for watching to this point. Bye.